Good afternoon, everyone. Welcome back. My name is Richard Humphries. It's my pleasure to chair this final session. I hear you've been having a great conference. I've been following it on Twitter, and I hope that in this last session we're not going to depress you by talking about politics and politicians. But we do know that on the 7th of May next year there is going to be a general election, and this is always a really important opportunity to debate issues that are really important to the country. We have a voice and we have a vote, but will social care be one of those issues? And that's what I'm going to invite shortly our panellists to share their thoughts about that. Is that better? Yeah? Okay. But by way of introduction, I just thought it'd be useful if we went back and look at what happened last time, if you can bear it, the last general election. Because 2010 was actually a busy year for social care policy. We had a big, ambitious white paper from what was then the Labour government, and Andy Burnham still talks a lot about the idea of a national care service. We had the somewhat ill-fated Personal Care at Home Act, which never quite made it in terms of implementation. And then, remember this, we had that big bust-up between the political parties just before the election about how we pay for social care, the so-called death tax row. And Alex, if I could just ask you to move your head a little bit, because they can't quite see the full glory of the death tax poster that scuppered the cross-party talks that was going on. There we are. It's okay, you can move back now. So, what did the parties say last time before the election? Actually, not a lot about social care. The Liberal Democrats talked about integrating health and social care. There's something new. And there were various pledges about local government and the NHS. The Conservatives talked about a single health and social care budget for people with long-term conditions. And Labour, of course, had its National Care Service idea. And actually what we got was a coalition government, and one of the advantages of a coalition is that the two parties have to agree and write down what they're going to do. And actually there was a few things there in the programme for government back in 2010 that they said they would do. A commission on long-term care, which turned out to be the Dilmot Commission. Breaking down barriers between health and social care, that integration issue again that you've been talking a lot about today, extending personal budgets, improving access to respite care, and so on. But there was a huge caveat with all of this, in that they said the deficit reduction takes priority over everything else in this agreement. So the point I want to make really is that what the politicians said before the last election actually bears very little relationship to what actually happened after it, for good reasons and bad reasons. So the Care Act, for example, I think we will all see as a positive thing, but the cuts to social care have been pretty awful and not getting any better. So that is just by way of context. So let me ask our panellists to give their ideas really about what they would like to see the next government prioritise in terms of social care. I'm keen to get your views, and I've asked the panellists to be as brief, as punchy as possible, so we can make this a kind of an interactive final session. I've also got a few questions coming in via Twitter, which I want to put to the panellists. So, Alex, let's start with you. I'm not going to introduce the panellists, by the way, because they're already world famous. And in the interest of their modesty, I don't want to kind of, read out their biographies. But Alex, everybody knows who you are. So tell us your thoughts.
Right, okay, so three things for the next government. I think the first one for me is no more institutions for people with learning disabilities and clear dates for closing the ones that we've got. The Bubb report that was published today, lots of debate on social media, lots of differing views on it, but I'd recommend reading it because it says that and some other really useful things and talks about ways that that could happen. And people with learning disabilities, I think, are really clear that they don't want an improvement programme, they want a closure programme. People will always have mental health crises, but when somebody with a learning disability has a mental health crisis and needs to go into hospital, that should be an experience that any of us would expect, which is focused on getting out and back into the community and home as quickly as possible. So that's number one. Number two, let's not get hung up on integrating different health and care structures and spend another 5 years debating that. But let's have a national health and wellbeing service. And what I mean by that is that the health and wellbeing and care systems working to a single set of wellbeing goals, which look a lot like the definition of wellbeing set out in the Care Act, which I think would work just as well as a goal for the national health system. At the moment, we've got bits and pieces of community development work, community capacity work, wellbeing work, prevention. It's still too far around the edges, while the real money and power is still far too centred in our hospitals. If we set the right goals, that will start to shift, but they've got to be set across the whole system. And thirdly, let's also stop debating whether public services need to be privately owned or publicly owned and instead commit to them being people-owned. I'd like to see cooperatives and other forms of mutual as the default model of ownership for service providers. I think every sector can be people-powered or not people-powered, including charities and public sector organisations. What the test should be, are they people-owned? Are they employing people who use services and their families in real roles, leadership roles, provision roles? Do they have a governance structure that embeds co-production through them? So let's have a people-powered NHS, people-powered social care.
That's great, Alex. Very punchy. Colin Noble, perspective from local government as an elected member.
Well, we produced a first 100-day paper, and the power of it is that instead of being one political party, the Local Government Association is all the political parties. So we speak for local government, and it is cross-party. So this is the same ask to all of the parties, and I think all the more powerful for that. Our first one is something around the first Queen's speech, really. We would like to see a new public services bill, and we would like to see the health and wellbeing boards that came about through health reforms actually raised up and enshrined as the place where primary, secondary and social care comes together. And we think that's an important aspect to actually take what we've got, where it is, and actually move it forward. And I think in the first budget, what we'd like to see is we'd like to see the pooling of all the money. We've got the Better Care Fund at the moment. It's a first tentative step. We've seen the acutes kick off and essentially money come out of the system again. And what we're saying is that we would like to see all of it pooled, but we would like to see a transformation fund, possibly funded by the alteration of the Barnett formula, and actually allow that to appease the acutes, but to bring all the money together in one pooled fund. So instead of doing it in stages, having a relatively big bang approach and getting on with it, which is what I think we all ultimately want to see. And I think also then what we'd like to see, again in our first 100 days, is we would like to see the status of social workers changed. So we would like to see a national campaign, we would like to see 1,000 graduates enter social work, and we want to see a campaign to stop people leaving the profession, which we think is a real damaging aspect to it as well. We also would like to see something around volunteers. We would like to see this enshrined in a slightly different way. We've had a whole load of initiatives, but what we would like to see is volunteers who operate in their communities actually get council tax breaks. So if they're shown to be volunteers in their communities, they can get small discounts, but to show how much we value social work in our community. And fundamentally, we want to see that as this moves forward, things are based around people, that they're locally accountable, that they're evidence-based, that they support a place-based approach, and fundamentally, that they actually will make a genuine difference to the system.
Colin, thank you. Some nice punchy points there. Sherone.
As a carer, I haven't got the same output as the people around me, but what I'm bringing to the table is the views of carers. For the first time, we have a legal status. We are now being seen as a group of people who actually can hold the government and hold our councils to account for what we're not getting. We were promised the earth last time, reduction in bureaucracy, reduction in the issues between health and social care. That's not happened. All we've got are still more complicated form fillings, more complicated jargon, more complicated who's doing this, who's doing that. More issues with discharges from hospitals are happening all the time. I'm not bothered about what health and social care are doing together. All I want to know is that when my dad comes out of hospital, you're not going to fight about who's paying for him staying longer in hospital because he can't manage to get to the toilet at home. Sort it out. Integrated care means, please don't let us pay the price for it when we're at home. We want absolute reduction in the bureaucracy. We don't want to know which organisation is doing what for us. Just do it. You know, seamless, beautiful, just be there for us. Health and social care, iron out your problems, get on with it, get along. You know, you've been around next to each other for a long time. Play nicely, help us out. Make it real and meaningful, not just lip service anymore. Because now we've got legal status, we will fight and you will feel it.
Great, great to see some passion there, fabulous. Okay, so on to Cathy Roberts from a mental health provider perspective. Cathy.
Hi. Well, my first one really is about prevention, and prevention being seen as important for long-term gain, really. An investment, not rhetoric, in services for prevention and support that are often seen at a local level as low-level services and crisis seen as the priority. And I think you need to look at personal benefits and cost benefit of better prevention services. Within mental health, I want to be able to see that the parity agenda continues. There is still a lack of spend compared to what they call the burden of disease, is actually what needs to happen with mental health services and the expenditure against that. And that needs to continue. There has been a commitment from this government, and we want to see that move forward. It's been slow. The other one is real co-production in market shaping. For people with lived experience, the experts, the providers who work alongside people and have been working alongside people for many years and seen as crucial and equal, not somebody who is a recipient but a contributor, and not seen as driving down to the bottom in costs for an easy option in people who provide services. If you do that, you drain the pot and there is no choice for people. So it's about that choice, it's about investing in that choice. And I take on board completely, if you look at the feedback today that came from Stephen Bugg's report, that, you know, this needs to be funded. But I think the key element here is that you fund in prevention and you fund in families, networks and communities, there is a better chance of preventing crisis.
Cathy, that's great. And finally, David Pearson, who you've heard from already today, so needs no introduction. David.
Okay, this is the Beecher's Brook of issues as we reach the canal turn of a general election, and that's only because I'm desperate to get a kiss off Clinton before I leave. Three things. Well, first of all, is it a general election issue? Well, it could be, but it would require everybody in this room, all of you, and everybody you know who you're going to talk to about it to make sure that it is. Because and we go back to the point that this was an issue with the YouGov poll by the Care and Support Alliance indicated that second only to the NHS, people were concerned about social care. So I think we need to take advantage of that. I would make 3 points too. The first is that I think that the issue of integration is not up for grabs. Everybody's talking, all the political parties, about integration. It's the form that matters. It's the form that's up for grabs. And I think the form, we would argue, should be around that personalised approaches. Because you can have a form which is a national health and care service that's got nothing to do with personalised approaches. So integration could be that way. It's possible, it's a risk. And I think that's why today's discussion has been so important, and the issues around health and care personal budgets. Of course, it's not just about health and care personal budgets. As I said earlier, it's about good advice and information. It's good prevention and reablement. It's personal budgets, and it's building that community capacity in terms of the well-being that Alex referred to. Secondly, you can't do this from a national position. You can't do this from Whitehall. And for two reasons. One, because it's just not possible. And secondly, because it's not just about health and care. It's about health care and other public service organisations, local people and communities at a local level. That's where it really works, when people get it right. And I think, therefore, something like the Health and Wellbeing Boards, in an inclusive way, is a good vehicle for it and should be trusted and pushed. And finally, to mention filthy lucre or money, we do need a system as the 5th richest country in the world, who are not spending anything like as much as many other countries on health and care, that actually if we want a system that we're going to be proud of and can own and what can aspire to, then we need to do all the right things to make services cost effective right throughout the system, which we currently aren't, but that the level of need going forward is such that we will need to invest more as an organisation. And it was the Barker Commission, under the auspices of the King Fund, and Richard worked very closely with it. And Dame Kate Barker is a 3 times member of the Monetary Policy Committee of the Bank of England, who said it is implausible that we will not spend a greater proportion of our wealth on health and care in future. And for a very measured economist to say it is implausible, she means it's ridiculous. So that's my proposal for the general election.
That is a great collection of punchy points for us to consider. I want to kind of serve notice on the panellists now that right at the end, I'm going to put you on the spot a little bit and invite you to consider if you could require the political parties to make one pledge, just one pledge in their manifestos about social care, what would it be? Okay, so what would be your entry into the party manifestos about social care? So give you some time to think about it. Let's open it up for questions. We've got a priority question from someone who I know has got to catch a train. So raise your hand, Mr. Richard Watts, and microphone for that man, please, who's going to start us off with a deeply cynical question, I know, Rich, but let's get it out of the way.
It's 2 deeply cynical questions, and they're quite political, so you have to excuse me for that, if that's okay. First question is, what does the fact that a Lib Dem has held the care services portfolio within over the last 5 years, what does that tell us about social care as a political priority? And the second one is, how much social care was there really in the Health and Social Care Act?
Okay. As I said, it's a deeply cynical question, that first one, wasn't it? Let's see what the panellists make of it. Now, I'm not going to sort of expect all 5 panellists to answer every question because we won't get through many, but who would like to have a... Colin, as a politician.
Well, I met Paul Burstow, and we were talking about the Dill-Knot reforms, and we were talking about exactly where the caps would be, and then he lost his job. And most people are reasonably clear that he lost his job because he over-pushed that it should be the lower limits and not the higher limits, and Treasury stepped in, and Treasury decided, now whether that was Danny Alexander or whether that was George Osborne, I don't know. And Norman Lamb has come in. He's not from my political party. I do know him. I think he's done a good job. It is a very minor player, frankly, within DH and certainly within Treasury. But at a fundamental level, I think the thing they are trying to get across here is that if you look at what Treasury spends, if you look at 1/6 of the spend of the entire country, actually social care has a really important part to play in how you're actually going to not just see that creep up and up and up. It's an ageing population. That's the #1 game in town at the moment, and it's going to be for the next 20, 30, 40 years. How you deal with that is through social care. That's what will control the spending in the NHS, and that is what will get Treasury's attention. So it does matter. I just don't particularly agree with the Liberal or Conservative thing. I think the reality of it is that they're the people who have come into the role, and I have to say Norman Lamb, I think, has some traction, particularly around this particular point.
Anyone else would like to comment on that? Or David?
I think it's fair to say that social care hasn't been high up the political agenda, as much as I like Norman personally and think he's a committed minister. But that's not his fault. I think my challenge back would be it's for all of us, actually, to make it a priority. And I think we've also got to be more articulate at explaining, A, what social care is, because the first thing I do when I get in a taxi is they say, what do you do? And I explain, and then I have to say, actually, it's about the care and support of older people and younger adults working, they get it then. So something about what it is. Secondly, what it can do for people's lives. So, and thirdly, what contribution it makes to the economy. And Skills for Care did a piece of work which talked about the economic value being 43 billion. But I think it's for all of us. It's not just a few politicians.
Okay. And in the interest of political balance, I mean, I should point out, I think under the previous Labour government, at one point they actually downgraded the post. It was from Minister of State to Parliamentary Under Secretary, which really is at the bottom of the ministerial food chain. I think they have corrected that since, but none of the parties really have ever seen this as a big hitting ministerial position. Okay, let's get some more questions. Any hands in the air? Okay, while you're making your mind up, let's take one from Twitter then, which is from George Julian, who poses the question about how do we engage people who use services in some of the political debate that we're having in the run-up to the election. That's a great question. Who would like to go? Sherone?
Yeah, how do you engage people in that agenda? Because it's tokenistic across the board. As part of National Co-Production Advisory Group, where in TLAP, we can see that's being modelled really well. Individuals, service users, carers are being used in a real meaningful way, but that doesn't feed all the way down to localities. Okay. Islington demonstrated today how well they're doing it in their borough, but that it's not mirrored across the country, and it really needs to be. Because actually, who knows best how to live their lives and how to care for the individuals? It's the individuals themselves and the family that are with them. They're the ones who know what needs to be done. They're the ones that should be involved in making sure that what gets spent and how it gets spent is done in the way that meets their needs, not some political agenda.
Okay, and organisations like LGA and ADASS will be kind of setting out their position, won't they, about all of this? Alex, you wanted to come in.
I think it's difficult to engage anybody in politics if they don't feel that's going to be meaningful. And I think I'd agree that there is... we haven't gone anywhere near enough to demonstrate and role model power sharing within public services. And I think if we can do that and create an environment in which people who use services and families aren't just getting choice and control at an individual level, but actually are able to have a real stake in planning and commissioning and developing and owning services, then people will be engaged at that level, and then I think people will be more likely to see the point of getting engaged at the political level as well.
Okay, good. Lady down here.
Thanks. I would like to know what the panel thinks about this. I would like the next government to really invest in family leadership and leadership by self-advocates. I think that co-production happens in a really small number of organisations. TLAP's a good example, and we heard from Islington. But it seems to be on the terms of the organisation. They initiate it, if you like. So I'd like the next government to invest a per capita amount for all carers and self-advocates around family leadership, and I think that would really support and underpin genuine co-production and also community development.
Okay. That's an interesting idea. Panellists, any thoughts about that? Colin?
I think the biggest challenge is that just because we have an election, it doesn't alter the underlying economic realities of what's going on at the moment. And the fact is we have a deficit. The fact is this coalition government has slowed the growth of the actual debt, but it's still growing. And you know, all parties are talking about till 2021. Actually, if you look at it, the likelihood is this is going to be the agenda for a lot longer. So you have to frame these things in how it's going to save money. And fundamentally, what we do know, there are pockets of, certainly in Suffolk, we've got a particular way in which we're developing it, and it is contributing to the savings. Now, whether that succeeds or fails, I'm not so sure, but the reality of it is I think all of these things have to be couched in what is the bigger agenda. And it is the elephant in the room. Money always is going to be for the next foreseeable future. And I think you have to look at it from that perspective. And if you can, and make the case and show the pilots and show the examples that when you do this stuff, you do save money, then I think you get the ear of Treasury. And if you don't have the ear of Treasury, then quite frankly, you don't have anything.
Okay, David.
If I'm being completely candid, most directors, in fact they told us this in July, are worried about having enough money to provide people with adequate quality care at a reasonable quality to meet their needs. So that would be my number one priority. I accept your point about co-production and it being partial. However, there is evidence across the country that it is more than Islington and other places. There are some pretty good examples up and down the country. I fully accept, and the Poet survey that I talked about earlier and the ADASS budget survey indicated that we've not done the job yet. But I probably wouldn't go as my first priority for a capita allocation in the way that you've described, but your point is well made.
But this money, I mean, it's not so much the elephant in the room, it's an entire menagerie of animals in the room, isn't it? Because all the parties at the moment seem to be saying that if they won the election, they would carry on with austerity policies, that they would still want to reduce the deficit, and there is not going to be lots of new money. Labour are saying that, Lib Dems are saying it, Conservatives are saying it. The only difference I can seem to see is that the Labour are saying, well, our cuts won't hurt quite as much as if you elected another lot. So how do we make the case for more investment in social care when the political dice seem to be loaded against that sort of discussion? And, you know, what can we all do via our kind of candidates in our own patch or via our national organisations or whatever? How can we really get social care on that political agenda? Because there's a great danger at the moment that it will get drowned out by the NHS. Panellists, any thoughts? What can we do to get social care on the agenda, on the radar for the election in terms of money?
I think it probably has to be through expanding people's understanding of what they mean by healthcare in the NHS is probably realistically the starting point, even though it's not the ideal starting point. I think the debate that we've been having about spending money just now feels to me like it's about this ongoing divide we have in public services between the core business and what we see as prevention. And I think that is the sort of the root of all evil, really, within public services when it comes to putting money in the wrong places. So we need to demonstrate that collaborative models of care, which are the only way in which people with long-term support needs are going to be able to live well, and that is the core business really of the NHS. We've got to demonstrate that those collaborative models are the only way, that they're worth investing in, that they need money ring-fenced around them. And if we do that, we will start to shift the way that all kinds of models of care work, whether they currently take place in hospitals or in the community. But it's got to be about demonstrating that things like your suggestion aren't just an add-on to an overstretched system. They are the only way, they're the core business.
Okay. Sherone?
And if you really want to save money, then you really need to look after your family carers. With the right information and the right advice and the right support at the right times, those crises won't occur. They won't end up in acute services. They won't end up in hospitals as delayed discharges because we'd have avoided them getting there in the first place. So look after those families, make sure that they know what they need to know at the right time, and that will help make sure that your budgets get reduced as you need them to be.
Hey, Colin, then I'd like to bring a couple of people from the audience. Colin.
I think you've got to think about quick wins, and I think if you look at the Better Care Fund and you look at what the acutes have been saying and why we've sort of stepped back from it, I think politicians at this time of year get very exercised about hospitals going on to Black Watch and going on to alerts. They get very exercised by A&Es effectively failing. And I think the quick win, because the difficulty of the prevention agenda is it's quite a slow burn. And the reality of it is that politicians are relatively instantaneously people. They deal with the things that sort of bite them on the bum fairly quickly. And I suspect if you could actually get some quick wins in place about how you suddenly could arrive at a point where, why is A&E not so busy? Hang on, the things seem to be, is it just easing down here? And actually, if you can demonstrate, and there are some very simple things around the way in which you put support into care homes, the way in which GPs work with care homes and these type of things, how you can dramatically lower the number of admissions into hospitals, into A&Es. And I think if you could get those quick wins and demonstrate these things quickly, I think you get the attention of politicians. And that's the difficulty with a lot of this stuff. When you say if we invest in this agenda over the next 5 to 10 years, it's going to... Politicians tend to go, sorry, 5 to 10 years, I'm dealing in 5 to 10 minutes here. And I think there's an issue about quick wins and being able to demonstrate the power of doing this stuff.
Okay, thanks. Cathy?
I just wanted to bring in also about pressure points within the NHS. We know that in mental health, some of those pressure points in low, medium, secure, yet there are some very good alternatives and developing alternatives, particularly within housing and access to housing and step-down services, and it's about being able to demonstrate what benefits they do. I don't think all of it's a quick win. I think there's pieces of work that need to go on there, but it's about being able to unblock traditional practice within some of the NHS settings and show how social care, some of it, as Alex quite rightly said, within collaboration, can work better for people and individuals have choices, because not many individuals really want to be into a 24-hour setting. They want to live within communities, they want to have their networks.
Okay, let's get some views from the audience. There's a question down here, lady at the back and gentleman here.
Hello. I just wanted to make the point that really politicians and governments shouldn't be just thinking about their next 5 years, but we really need to be thinking on a much, much longer term basis if we want to really change the infrastructure that we've currently got, and we actually really want to change health and social care for the better. I think that health and social care should be a political issue in the first hand, but I think that it's a much more fundamental issue across all aspects of life and all the rest of it. That thinking in the next only 5 to 10 years seems slightly irresponsible.
Yeah. Okay, and I think other people have said we need a 10-year agreement between the parties, but how realistic is that you're going to get politicians to agree something for that long? But that's a very good point. Lady at the back has had her arm up for ages.
Just one thing I'd also been thinking, that could you not also save money by involving people who use services as well?
Yeah.
Well, that's what I generally think.
Yeah.
Because by involving them, speaking to them, and you hear what they want, you get it right first time, you're not wasting money on making mistakes or putting things right, and win-win.
Right, yeah, good points, yeah. Round of applause there. Good to see a bit of passion, yeah.
I just wondered what the panel think there's scope for a social movement to try and press for increased funding in publicly funded care services, given the fact that for all the integration, all the prevention, all the improved approaches and healthy lifestyles will probably reduce the pressures from an ageing society. That still leaves us a lot short of where we need to be, just to reflect perhaps Kate Barker and what David Pearson was just saying. So is there a scope, without having to get into the murky world of party politics, all these various social movements that have been very successful in shifting the thinking around personalisation, co-production, could they go out and say, actually, there's a lot of people out there who are prepared now, perhaps the first time in a generation, to see increase in taxation to provide a civilised care system that I think most of us want. Most of the meetings I go to, carers, users, other politicians are actually increasingly in favour of that option, but they don't feel that at the moment that's being given to them. So I just wondered, what about the social movement?
So taking the debate to the politicians, yeah. Panellists. David.
Well, starting at the end point, I agree with you, actually, and I think we've got to stop just talking to ourselves and agreeing with each other violently. We've got to be having that conversation with the public and with other parties. And I think the Care and Support Alliance, which is an umbrella organisation of well over 70 organisations, did a terrific job at each of the party conferences for example, in making sure that it was profiled at the party conferences. So that's one example. But there is a groundswell of a coalition of opinion that I think you're tapping into. And I totally agree with the point about involving service users. I think the other two quick contributions I'd make to this is, one is that I think the CARE Act is a constructive contribution to the debate, because for the first time for a very long time, Parliament has talked about what it thinks is a reasonable care system in the 21st century, only in May. And it was quite interesting that when the National Audit Office published a report in May, the Public Accounts Committee said, oh, perhaps we haven't got enough money, perhaps we ought to delay it, which I thought was an interesting response since the legislation had just been passed. So there is something about using that as a constructive basis for what the conversation about what does this cost. And my final point is about the articulating the view about what good community-based personalised services look like. And so if I pick up the Winterbourne View debate today in the Stephen Bubb report, clearly one of the issues there is having sufficient resources, both in terms of not just care but housing and other facilities, to make sure that there are viable options in the community for people to take advantage of. And that's clearly a crushingly important need in relation to Winterbourne View. There's a moral imperative around that, but there's also a practical issue about making sure that those services are in place.
Colin?
I think local government is very, very clear that it wants tax raising powers, and it wants to divorce itself from central government in many, many areas. It tends to do it on an argument of look to Europe, look to regionalisation, look to economic growth. It is better where you have local administration of a lot of those things. But there's certainly, we are going through a period at the moment where an awful lot of local government has been zero council taxing for a very long time. And it comes on the back of a period of time when there were significant rises in council tax. So it sort of ebbs and flows, these things. But I think an awful lot of people are saying that you can't just keep coming up with zero council tax increases and making the cuts. You have to start to articulate a way in which you increase the council tax. Now, is it going to work simply by saying that you take the cap off and councils start to say, right, we're going to put 5% on here or 3% or whatever it is? And I think a lot of people are starting to say, no, you've got to be far more sophisticated than that. What you've got to do is you've got to directly link it. So if local government can have more tax-raising powers around council tax, and everybody can argue about, is that a mansion tax, is that a local income tax, is that a poll tax? No, we won't go there. And a whole range of those type of things. But if you can directly link it, so in this area, we prioritise these services around carers, around personalisation, around social care, and therefore we are asking you to contribute more money for that. That is a debate I think that politicians are starting to have. I think a lot of politicians are very worried by that debate, to be perfectly honest, but I think they're starting to have it. And I think long term, the zero is unsustainable, and I think those conversations will start to happen. And in many, many ways, I think what the coalition government or the Conservative Secretary of State is doing around the sort of cap, I think stifles some of that discussion, because I think there's a lot of councils out there that would like to think about increasing the council tax, but if you can do 1.99, the reality is you're not going to bother. You're going to take a lot of grief for a very small amount of money. In a county like Suffolk, 1% is 2 million quid. It's not a lot of money in the context of what you're spending. But I think if you take it off and allow, it will be interesting to see how different councils articulate that and what they link it to, and I think an awful lot of it would be around personalisation and social care.
Okay, thanks, Colin. I'm keen to squeeze in a final couple of questions. So there was somebody at the back there, a lady at the back, and if they're very, very quick, we'll try and get you in as well, because we're starting to run out of time.
Right, yeah. Thanks. When I hear that the amount of corporate tax breaks exceeds the amount that we spend on the welfare benefits, and when I hear that MPs turn down a 1% rise for nurses but give themselves a rise many times that, and when I hear about the plans for the costs for the proposed refurbishment for Westminster, the Palace of Westminster exceeds the deficit, the projected deficit for the NHS, then I contend that party politics has completely failed, not just disabled people, but society at large? And when will you give us a truly democratic choice of saying none of the above at the next election, so we could have a proper national debate on reforming politics? Because it's not fit for purpose.
Thank you. Very powerful point. I suspect beyond the pay grade of our panellists, but that's a very strong point made with conviction. Next question. Yep, we can hear you.
I just would like to say there's been no mention of the Lenin LB bill, which people like Mark Neary and Sarah Ryan have been working on, but also the Learning Disability Alliance was launched on last Friday. That's not been mentioned either. Do people know about it? Are people going to join it? Because we need to defend people with learning disabilities' rights and everybody else's.
Okay, so this is the Justice for LB campaign. This is about a young man who died in a NHS learning disability unit. He drowned while he was having a bath. He had epilepsy and he wasn't being looked after properly, in effect. So there's a campaign and a draft bill. So we'll invite the panel to comment on that briefly. And then final question.
I would agree that we do need better co-production. To give the power of local authorities to raise taxes, to empower themselves, would be a disaster. If you want to develop co-production, weaken the ability of the local authority, strengthen the ability of the carer and the service user to start to take control, because maybe I think that's the only thing that local authorities will legitimately listen to.
Yeah. And we've had some questions via Twitter about the role of personal health budgets in actually driving that forward, which I don't think we've got time now to get into, but both positive and negative comments about the benefits and the risks of personal health budgets. And we've also had a comment about whether the word social care actually does it encourage people to leap to its defence in the way that the NHS sort of gets this massive popular support? I think that's something for all of us to think about. I know we're running out of time. Just want to register with the panel about the Justice for LB bill. You're nodding your head, so I'm assuming that you know about that. So that point is registered. So quickly, let's have your one pledge that you'd like to see in the manifesto.
So, yeah, thanks for raising the Justice for LB campaign and bill, which I strongly support. The one ask, I think, would be that a cross-party agreement on that 10-year settlement. If we can have coalition government, surely we can have that. And a settlement for investment in whether we call it collaborative care, prevention, resilience, building community capacity. That community development orientated support for people to maintain and sustain their well-being, investment in that over a long period.
Okay, Colin?
Somebody said, just sort it out. And I think that has to be the point. And what the LGA is asking for is for the health and wellbeing boards, for their place to be confirmed and for it to be enshrined, and for that to be the space where we sort it out.
Okay, Sherone?
My most radical ask would be, look at carers' allowance and please think about the sandwich carers. There are a number of carers out there who are providing more than 50 hours a week support to more than one member of their family, but because it's not 35 hours to one person, they don't qualify. So please have a look at that, because there are people who are on their knees and they really need that help.
Thank you. Kathy?
I think it's a tough job being in social services at the moment. I've just through the discussions, there's Winterbourne today, there's mental health, there's increased need in dementia care, there's care and support for people who are living longer, there's carers, and I feel quite selfish to say this, but I think my plea would be to address the imbalance in mental health and well-being, which is massive, but I don't envy David his job at the moment.
So, David, we're all waiting with bated breath. What's your...
I just want to say, in response to that, I'm very hugely privileged to have worked in social care as long as I am, and I still consider myself to be so, but thank you. I would say align the funding for health and social care, so the settlement for health is at the same level as it is for social care and vice versa, because I think the Care Act and the energy around that provides the basis for a good system if we can make that work.
That's great, David. That's a good note to end. And I think as we're at Aintree, can I get away with saying that I think we have raced towards the finishing line? So I want to send you out with a smile, you see. Now, listen, there's one positive thing that we can all do, because I often hear MPs say that they don't get social care in their postbag. They don't have people turning up at their surgeries. One thing that we could all do when the election campaign kicks off is to write to the candidates or ask them, what are you going to do about social care? Okay, so that's one practical, positive thing that we can all do. So on that positive, practical note, I thank you for your great questions, but can we also thank the panel and for people that have contributed via Twitter. So thank you. And a safe journey home. I'm not sure if there's any final sessions, Sam? Yeah.
Okay, folks, just a quick one. I'd like to thank everyone who's stayed to the end. I think you all need a round of applause, so could you join me in a round of applause? And a quick message, that themes that I've got through the day is around a common language of describing social care, parity of esteem in health and social care. The one thing that I've been banging out today that I want everyone to take away is it's about, people keep saying to me they want to thrive, not just survive, and recognise the role that people can play in being part of the solution.
Thank you, Clinton. I just wanted to say one final thing, really. My only real hope for today was that people that came here left with a sense that you were at least somewhat rejuvenated and able to return to the very important work that you do every day with a bit more of a spring in your step in these difficult times. So please do fill in your evaluation forms and let us know if we've achieved that. All of the plenaries from the day have been live streamed. They'll be available on the TLAP website if you want to watch those back at any stage, and we'll be tweeting about them so that others that weren't here are able to see those as well. And finally, really, a huge thank you to all of the TLAP team that have made this possible, and to the fantastic members of the National Co-Production Advisory Group that have enabled us to co-produce this conference. Hopefully you'd agree very well. Okay, have a safe journey home.